Thank you, Joy. Starting with our external environment, we use the pest analysis method to help us understand those driving forces. Starting with our political environment, our state has a certificate of need law, and that's important to understand when we look at proposed strategy options. Also, there are two authorities conducting hospital feasibility studies in Jasper at the request of their citizens and the governor. Also, in 18 months, it will change from the employee to the employer who chooses where workers' compensation care is conducted. And we see this as a unique opportunity in the future to potentially drive patient volume. Next, looking at our economic factors, it's important to note that Middleborough and Jasper act independently from each other. When looking at Jasper, they have developed a strong economic base, and that will continue to grow and be fostered by the interstate highway that now connects them with Capital City. In regards to Middleborough, they become economically stagnant, mainly due to the downturn in the industrial and manufacturing sectors. And looking at our social environment, Jasper has grown by roughly 9% in the past 10 years and is now the largest city in Hillsborough County, compared to 2.5% growth for Middleborough during that same time period. And looking at our age distribution, roughly 9% of Jasper's population is over the age of 65, and 14% of Middleborough's population is over the age of 65. We see this as a unique opportunity because we believe that age demographic could potentially require additional healthcare services. Finally, looking at our technology forces, the rate of change in Hillsborough County has been historically slow, but recently, the two hospitals in Middleborough have become affiliated with larger health systems, which has brought current technology to the market. We see this trend continuing, and for the future, that new technology is introduced. Next, we're going to look at our internal environment. We use the SWOT analysis method to help us understand these forces. When we look at our strengths, we consider ourselves to be an established provider in the county. We can trace our roots back to 1951 and now have facilities in Jasper and Middleborough. Also, our facilities are modern and have room to grow. Each facility has CT, MRI, and X-ray capabilities, which allows for efficient patient care. Also, year over year, our revenue has grown, and we're nearing $50 million a year in revenue, mainly due to patient growth. We look at our weaknesses. They're mainly around staffing challenges. For example, we currently have physicians driving from Middleborough to Jasper to help cover surgeries, which is causing frustration and also loss of time in transit. In addition, we have a practice where registered nurses are replaced by medical assistants when they depart the organization. This has caused a lot of frustration within the system and needs to be resolved. Also, a recent national study conducted showed that our consults per hour for peds and OBGYN are lower than that standard. With this higher demand, we need a review of this system to help us understand how we could become more efficient. When looking at our opportunities, we have a land option that expires this year and potential real estate developer who has a bid to buy this land. Also, Cardiac Hospitals of America has approached us to be a minority owner in a new facility in Jasper. This is unique to us as we've never been a hospital operator. Also, currently our ambulatory surgery volume out of the Middleborough facility goes to Midcare, and we have the room and equipment to expand in Middleborough facility and bring some of those patients in-house. Also, we have two individual firms that have approached us about selling all or portions of our practice. Finally, when looking at threats, Capital City Medical Center has recently bought a land option to explore putting a medical office in Jasper. Our current competitors are only solo practices, so this would be a new threat for us. Also, it's important to note, in the past few years in Hillsborough County, private medical insurance has declined by roughly 5%, and government insurance coverage has increased by roughly 5%. And this is noted because we need to continue to offer cost-effective care. Thank you. And Spencer will go over proposed strategic options next.